Welcome to the AOT Monitors Web Chat. My name is Sarah Hyatt, and I serve on the Treatment Advocacy Center AOT implementation team. I'm actually the newest member. And my role is I am the Senior AOT Legislative and Policy Counsel. And I'm an attorney and a nurse. And before I came to TAC, I was a monitor in Hamilton County, Ohio. And so before we get going today, I would like for our team to introduce itself. And I'm going to start with our director, Amy.
Hi, everyone. My name is Amy Lukes. I have been at TAC for 7 years now, and I am a social worker by training. I started my career a long time ago as a case manager in community mental health, and we use what we call outpatient commitment. Uh, the rest of my experience has been in community mental health, working with this population.
Shanti, you want to go next?
Yeah, sure. Hi, everybody. Good to see you all, or at least your names on squares virtually. I'm Shanti. I'm the Senior AOT Research Advisor, so I assist with kind of research, program evaluation, data type stuff for our team.
And Jared.
Hello, I'm Jared Wyman Bradley. I'm the senior AOT advisor on our team. I'm also relatively new. And prior to this, I worked on the inpatient side of psychiatric care in a state hospital in Virginia. On our team, I assist with training materials and just helping prepare other programs in our technical assistance.
Thank you, Jared. And I would love everybody on this chat to introduce themselves. I'm not sure how we can accomplish that in the best way, but if you wouldn't mind just starting, well, with who?
Oh, Sarah froze. So I'm going to take over just quickly. First of all, we are trying to build community in these web chats, and we really appreciate if you turn on your camera. We understand if you can't, but we'd love to see your beautiful and handsome faces. Are you back, Sarah? You froze.
Am I back?
Yeah, you are
Oh,
back.
oh, great, great. Okay, yes, and I was also going to ask if you're comfortable, please turn on your camera so we can network and get to know one another. But I was asking if the order that I see folks in, I was just going to call you out and just ask if you would come on camera and introduce yourself and tell us who you are and what state and jurisdiction you're from. And I do see, I think it's Rachel or Raquel. I'm not sure. Can you go first?
Hi, it's Rochelle, and I am trying to turn my camera back on, but I'm having trouble locating it. But as soon as I find it, I will turn. I don't have a problem turning my camera on. But again, I'm Rochelle Rowell. I am the AOT coordinator for Health West, which is the community mental health in Muskegon County, Michigan.
Oh, so nice
Excellent.
to have you.
Thank you.
And I see Norma next.
Oh, you're on mute.
Okay, my name is Norma Linton, and I live in St. George, Utah. I am starting a nonprofit organization for schizophrenia. And I would like to know, I'm here also in behalf of Wendy O'Leary, who is an advocate in NAMI. She wasn't able to come. And I want to get in touch with you because I think that together we can make a difference. And I would like to know if there's someone from your organization close to us, close to St. George, Utah.
Thanks, Norma.
Well,
And do you know the answer to that?
the closest, I believe, would be Washington.
That's the closest.
Yep.
Okay. Then
But
later on, if you can send me information on how can we start being a branch of you here, that will be great.
super.
Right. Okay, how about Brandy?
Hello, I'm Brandy McCord. I'm the Director of Probate Services for Ross County in Ohio, and I'm the coordinator for our AOT program.
Thanks, Brandy. And Brian?
Hi, hello everybody. Well, I'm Brian Cook. I'm the Director of Crisis Services over at Southeast Kansas Mental Health Center. I recently had the pleasure of attending a statewide AOT meeting that Amy was participating in, as well as a couple of our Kansas judges. So that was really helpful. My context is that AOT is pretty new to Kansas, and it's really new to my area, my service area. We just recently had a judge agree to pilot AOT, very small, three participants only. So we are in the very fledgling state of trying to learn more about how to implement AOT.
Thanks for joining us.
Thanks.
And Anita?
Hello, my name is Danita Burke. I work with Oakland Community Health Network in Michigan, and I am an AOT case manager.
Thanks. And Amanda, who I know because she is in my successor role. So hey, Amanda.
Hi, Sarah. I'm Amanda Murphy. I'm the Probate Services Associate Director with Central Connection in Hamilton County, Ohio. Yes, I know Sarah very well. So hello, it's good to see you.
Good to see you as well.
Yeah.
And Jordan.
Sorry. Yeah, my name is Jordan. I work with the community mental health in Northern Michigan. We cover 6 counties and I'm the court liaison. So I've been working with our medical director pretty closely and over the last year-ish, really trying to develop and fine-tune our AOT program. So this got sent to me as something that might be helpful. So thought I would hop on and yeah, thank you for having me.
Join us. Yeah, thanks. And Carrie.
I am Carrie Crane. I'm the director of the Johnson County, Iowa AOT program. We've been in place for just over 2 years.
Thanks, Carrie. And Amy?
She can't, oh, you can talk, you just can't join on screen. Sorry.
Hi, I'm Amy Angel. I'm based in Little Rock, Arkansas, and I'm one of the monitors for our conditional release compliance program.
Oh, thanks for joining us, Amy. And Sabah?
Hi, I'm Sabah. I'm a senior legislative and policy counsel for Treatment Advocacy Center. I love sitting in on these when I can because it helps me lobby better for them at the Capitol when I can hear the actual people and how their jobs look in real life as opposed to just legislation on a piece of law. So that's what I'm here for. And I'm in Atlanta, and my power might go out, and I'll never talk to you guys again. We have a big storm. So.
Oh, good to see you, Sabah. And Ariel?
Sorry, it's a couple minutes late. I don't know what we just saying name and
yeah, just name where you're from.
All right. Hi, everybody. My name is Ariel Edwards. I'm a program officer at the Mental Health and Recovery Services Board in Lorain County, Ohio.
Thanks. And then, is it Rich?
Yes. I just logged on just this moment. If you're talking to me, I'm Rich Shaw from Tompkins County, New York.
Thanks, Rich. And have I missed anybody? If I have, just jump on here. I'll give it a second. I do not see anybody else. So I will then continue on. And before we start our discussion today, I did want to just address a few housekeeping items. One is if you have not taken advantage of the early bird special for the 2025 National AOT Symposium and Learning Collaborative, it will be ending September 30th, which means that the price will be going up. So right now during early bird registration, it's $199. It will go up to $250. And it will be taking place, the symposium, in Annapolis, Maryland on March 26th or 27th and 28th. And it's a gathering of AOT implementers and practitioners and champions. And it's a place where they all come together from across the country, and we learn more about AOT and network. So it's a really great opportunity, especially if you're first starting up. But I wanted to make sure that you knew about the early bird special before it's gone. And I think Jared's going to put a link in the chat for that, so you can take advantage of that. And the other thing is, if you haven't already joined the AOT Learning Network, we really encourage you to. It is an absolute treasure trove of AOT resources, and it's absolutely free. And again, Jared will put the link in the chat. And the other thing that I just wanted to ask before we get our discussion going is, are there any 2024 SAMHSA grant, AOT grant recipients on today?
We recently received a SAMHSA grant in Oakland County. My director isn't on here, but she's the one who would have like all the details about that. But we did receive a grant recently.
Terrific. I just wanted to just give you a shout out and say congratulations. You are about to embark on a very exciting and very important journey. So
Thank you.
congratulations. We're really glad you're here. And actually, we're glad everybody's here. And I wanted to point out that you all are from different states and you're operating under different statutes. And so your roles are going to, naturally vary a little. But what is most consistent about the AOT monitor position is that it is vital to the success of the program. And it is challenging. So that's why we have these web chats, is to give you an opportunity to just voice whatever you need to voice. It's a great forum to gather insight from others, to problem solve. You may want to talk about challenges. You may have some questions. You may even have some tips for the group. So this is your web chat, and I'm going to open it up to let you talk. Please don't be shy. And because there's such a small group here today, I'm sure we're not going to talk over each other. So it's very informal. Jump on, and I'm just going to open it up to you right now. Surely somebody has some challenges.
I actually have a question. This is Rochelle Rowell again. I'm from Muskegon County, Michigan. And right now, what we're trying to, well, one of many things that we're trying to deal with, I just kind of wanted to get some feedback from others on what it is that you guys do with those cases that are deferred, but, well, let me just give you this scenario. Here in Muskegon County, we may get people that come in and they get an AOT, and they may get a deferment, but they're not open to services with us. So there's no follow-up. And so I kind of wanted to know, what do you guys do, or how do you keep track of those deferrals that come through when that consumer is not open to your agency?
And
I'm hoping I'm making sense.
You are, but just for sake of clarity, because again, we all are from different states, can you explain exactly what you mean by deferment?
So the a petition is filed, however, the consumer opts for or asks for that a deferral conference, and that deferral is granted. But we'll get the court order, we'll get a notice saying that we will get this deferral, but we have no contact with that individual afterwards because they were not connected to our agency, because there they weren't open to us. They're not a consumer that we dealt with on a regular basis. So we have no way of keeping track of those deferrals. And then even what we should be doing with them afterwards. I think we should be, even though they're not open to us, we should be following up and making sure that they are, either coordinating them with services or things like that.
I have a quick question, Rochelle. So with you guys deferral conference, are you guys on the deferral conference as well, like with the attorney and the individual, or you just get notification of it?
We're just getting the notification. We're
Oh,
not
okay.
on the conference.
Because what we've been able to do, and like this is still new for us, but what we've been able to do on our end is our monitor hops in on it on the conference as well. And it's all virtual for us in Oakland County, but he'll hop on and he'll get their up-to-date information, say like, hey, this is the number I have for you. Is this a good number? Is there an emergency contact? And then information will go into like an Excel or smart sheet, and then just monitor that and do the updates that way.
And so are you guys reaching out to them? What type of follow-up are you guys doing with them?
My understanding is because I have a different role from him, but we are trying to like learn each other's role.
role. Mm-hmm.
But I in the smart sheet, it has like the date that this occurred, like this initial contact. And then after 30 days, I believe that's when he follows up, if I'm not mistaken, for the deferral conference. And I don't want to give misinformation, but I know for a fact that like he does hop on the deferral conference between the attorney and the individual and get that information and logs it into like an Excel to keep track of it.
Okay. Thank you. That's a good idea.
No problem. And to just to add, I don't know, do you guys are you a part of the Wayne State?
Yes.
Okay, perfect. Because I feel like
Yep.
they have some good resources as well.
Yes, I have been in combing that. I stumbled across TAC, yay, to get resources. And so, yeah, because it's a lot. It's a lot.
It is a lot of information.
So in Michigan, when a petition is filed, the respondent can ask for a deferral, and they're put in deferral status. But my understanding is if they don't follow up and uh, they require intervention, then a new petition does not have to be filed. They can go into AOT. Is that correct, Michiganders?
Well, there's a demand for a hearing if they don't follow through with after they requested the deferral conference, they've agreed to whatever it is that they discuss there. If they don't follow through with that, then they'll do the a demand for hearing, and then we'll go straight through to that process to get the order, the actual AOT order.
Thank you. Yes. Now, Jordan, you had your hand up.
Yeah, I was just going to add to Rochelle's question and similar to what they said they're doing in Oakland County. So we don't get included on all of the deferrals. Unfortunately, we try, but not all the hospitals include us. But after the person's discharge, what we've started doing is sending them a letter with a copy of the deferrals, just kind of as a reminder of what actually happened and took place. We were finding that a lot of folks were like, I don't remember what we were signed, while they were in that crisis or in the hospital. And then I would say we're checking in with them if they're not open to us about every 4 to 6 weeks. We try to check in with the person or their treatment providers if we know those. And often what I've been doing is going back to whatever hospital they were admitted and asking for like their discharge packet so we can kind of see what happened and where they might be getting follow-up.
Okay. And where are you all? Where are you?
I
I know you
I
said up
yeah,
north.
I'm in Traverse City, but we
Oh,
cover
okay.
6 counties up north. So
Okay.
yeah, Northern Lake CMH is what it's called.
Okay.
That's in Michigan, sorry.
Northern Lake CMH. Okay. It's good to know the Michiganders that are in here so we can reach out and bug each other. Are any of you guys planning on going to the conference? The Michiganders?
Which conference?
I'm sorry, the symposium, the AOT symposium that's coming up.
Yeah, a few people connecting. Oh.
I'm going. I'll be there.
Glad to hear it.
Yeah, that's great. Does anybody else have an issue, a tip, a question? This is a quiet group.
I actually have a question about when um, the black robe effect isn't necessarily playing that big of a role in our program. And some of the interactions have been negative, which has kind of pushed our participants away from that portion of the program, but still fully engage with the monitor and peer support piece. Are there any suggestions on um, maybe ways to better engage our judge or create a better environment when it comes to the judicial part of the program?
That's a great question, and I'm going to let everybody else weigh in, and then I think we have a couple things that we might be able to help you with. So does anybody have any recommendations here?
Just curious, how many of you have regular check-ins with your judge? Hand up if you have regular check-ins with your judge. So a number of you don't, which is fine. Just curious.
In New York, the judges don't have anything to do with the monitoring. If somebody wants to an AOT order, every county in New York has a director of community services who's ultimately responsible to track the AOT or people on AOT orders. And as far as tracking, say, people who aren't following through a treatment, we have a monthly meeting with a group of people, which include our hospital care managers and our ACT team and others. And we talk about the people who, and what their follow through is or is not. So we regularly keep tabs on everybody who's been ordered in our county to get on an AOT.
So thanks for that. I think that's a great example of how a program can function well without an active level of involvement through the judiciary. But my question on that question is it because the judge is offensive in some way, or what in particular is the issue?
I think partly yes. Partly some of the verbiage that is used when talking to participants during those check-ins, and kind of just not having the, gonna say, social work boundaries of knowing, like, don't talk about this client in front of another client type thing. And I think just presentation in general. I mean, the participants get along great. We have no issues with our participants on the daily service side of things. It's primarily when we have those regular check-ins.
Well, As I think Amy always says, it's easier to get a judge to change his or her way based on the input of another judge rather than any of us. So we have a few things. We have in October, in the October bulletin coming up, there'll be an opportunity for your judge to register for a judge's chat. I don't know if your judge would be open to that, but that's one option. And then we already have Judge's life coach in AOT video that's already out there. And I think, Jared, maybe could you put that in the chat? And that might be helpful. And then one other option is we have a judge who is part of our National AOT Advisory Committee who allows other judges to participate in his AOT hearings and by video, by remotely. And he's a very good judge, does, a wonderful job with he's very invested in his program, very engaged. So that might be another option. It's a tricky question, I think, but those are three options. Does anybody else have any other recommendations or advice?
I'll throw out one more just from our offerings. You can keep an eye out, Carrie, for in the October bulletin, which should be coming out next week. Our next webinar is going to be, it's Dr. Bill Fisher, who kind of runs the show in the New York City's AOT program. And like Rich said, New York does not have an active judge model, but they see really good outcomes and still have very effective programs. And so he's going to talk a little bit about that model of AOT as well, which might be helpful if some of these other things don't really resonate with your judge.
Okay.
Thanks, Shanti. That's helpful.
And because I know your situation, I'll talk after Brian, whoever just had their hand raised. I can't see you anymore.
Hi, yeah.
Oh, there you are.
Hi. Let me lower my hand virtually. Okay, so I watched the Judge as Life Coach in AOT video. It was great. A lot of good information. It is over an hour long. And what I'm struggling with is I could really use, in order to get my local judges to watch and really entertain this idea, if there was something condensed that I could really grab their attention with. And if it was formatted in such a way that it certainly covers AOT, but a lot of our areas, as I mentioned, a lot of our judges don't even know what AOT is. They know what an outpatient treatment order or outpatient civil commitment order is, but they may not be really familiar with AOT. So if there was something a little shorter, a little more condensed that I could send to them, that they could watch, and it would be applicable both to AOT, but also just kind of generally to outpatient civil commitment orders.
So just a thing about language. To us, outpatient AOT is the use of outpatient civil commitment orders. But the way we see it is that they are used systematically and collaboratively. So AOT is just another word for using outpatient civil commitment. In terms of what we have a ton of resources, written and also videos. We used to, well, I'm not even going to mention that. But if you could, if you want to put your email in the chat or send us an email at AOT@tac.org. Sorry. And we can get you a bunch of stuff. What I was going to say to Carrie, though, is because I know your situation, and in your case, this person, judge, his only role is to do check-ins. He doesn't renew orders. I mean, that is his role. And that it might be time to gather the team together or select members of the team to address that. I mean, that's what he was hired to do. I don't know how that sits with you, but
Well, we actually have as a team addressed it at least 3 times now. We have administrative meetings once a month. Originally, we were having check-ins weekly, and as I realized there was an issue, I actually started cutting back on the check-ins. It's where our regular check-ins are once a month, and now we're having formal status hearings every 90 days, which allows us, the AOT program, to get our paperwork into their court file. Otherwise, we don't have any other way to do it. Because unfortunately, in Iowa, the AOT program is separate from the outpatient committal process. So that's interesting to hear other AOT programs that the AOT and outpatient committal orders are one and the same. But with us, it is two very distinct things trying to work together.
Amy, could I dovetail onto the end of that now?
absolutely.
So for Kansas, it's true that as you said, AOT is just, it doesn't appear in our statutes, but it's just a more proactive, more involved version of a civil commitment order. But I guess I would just mention that for jurisdictions that there is no AOT program in place, something that could convince or at least get judges excited about trying to, maybe they're not ready to say, well, we're going to start an AOT program per se, but they might be willing to try to step up some of their civil commitment procedures, sort of moving in that direction.
Yeah, and as Sarah mentioned, judges unfortunately aren't as responsive to Susie's social worker as they are to their fellow judges. And you are very lucky that you have a gem of a judge uh, just to the north of you. And he is always willing to just pick up the phone and call. So I will send you his email address, Judge Winnell's, and just
I
say,
thought that might be who you were talking about.
yeah, just email him and say, hey, could you give so and so a call?
That would be
He'd
great.
be happy to do that. And you know, the same is true for you, Carrie. I think that Judge Winnell would be more than happy to call your judge, but from what I understand, that's not going to really make a difference. Tell me if I'm wrong. We're happy to do anything we can, but
Yeah, honestly, at this point, I don't know that it would make a difference, and I think I'm actually looking more towards the idea of the program not having that active judge role and trying to figure out how to make that work.
So I'm just curious of those programs, how many of you separate people on civil commitment with AOT? I mean, I think, does anybody else do that on this call? Alrighty then. Back to you, Sarah.
Well, I'm just curious as to if anybody else has any other challenges or anything else they would like to talk about. Is everybody able to get enough referrals to meet the needs of those in your community that could really benefit from AOT?
I mean, I'm in Lorain County, Ohio. We've struggled with referrals. I mean, we went from tons of referrals to a handful. And we even explored, our hospitals. We had one particular doctor who was just convincing everybody to come voluntary at one point, and the hospital wasn't probating as much. And I don't know, we've seen an increase since that doctor's left, but I still feel like we average between maybe like 12 to 20 folks in our program. And I'm not sure if that's, I know some county, I think Butler County has like 108 something like absurd. And I'm like, how do you guys do this? So I don't know I guess it just depends on each person's area, like what makes sense in terms of referrals. I mean, I think our judge knows that there's tons more people probably that we could be helping. But he typically only does referrals through the hospital system. So I've like asked like, hey, are you willing to explore the other options? And I've kind of gotten like the no, not necessarily from him, but his team is like, yeah, I don't think he's willing to do anything other than that. So I don't know if we're missing folks from other referral sources possibly. I mean, we have to be, is my guess. So that's kind of one of the things I always wonder about with other, programs, like people get referrals from the other options and we really don't.
So can anybody speak to that or want to?
Just say Hamilton County has currently 250. So we're very high up there. We do have 8 hospitals in the area, so we do get a large majority from the hospitals, but we do have a lot of of our the treatment providers, the agencies who work with hospitals who also make suggestions, and we'll ask for them to refer. And we do coordinate a lot with those treatment providers to get their opinions as well on if they feel like it's an appropriate referral as well. So it's kind of like a 2-step process. We get the referral from the hospital, and then we check in with the agency if they're connected, or the agency they will be connected to kind of get their input as well, to kind of get second pair of eyes on that referral as well, and that really works. But I also do think we just have a large county with a lot of hospitals that helps out, and a lot of buy-in into the system.
Thanks, Amanda. Yeah, that's the system I was from. And we have the opposite problem. We typically wanted less referrals, but I mean, not less. We want to serve everybody we need to, but one thing that I did learn early on in my role as AOT monitor in Hamilton County, and that was when we were trying to shore up the referral process, that the inpatient social workers, I know you noted that you try and work with the inpatient, but the social workers on the inpatient psych units are really, they really responded well when they found out about our outpatient commitment program, because they have the ear of the psychiatrists and the inpatient providers, but also they're largely responsible for the discharge plan. And so they get very excited about it because it's a really great safety net to send those problematic clients or participants out in the community. So that might be, another step you could take. I know that you've made connection with the inpatient process, but the social workers in particular might be a good place to go next and let them know about your program.
Yeah, we've done that. We've taken flyers, brochures. I think staff turnover has been part of the challenge too in the hospital systems. We can get them to let us know when they're discharging people every time. I mean, it's just two hospitals. One of them is not a great hospital, no matter what they do. It's like a countywide known, don't go there if you don't have to. But we're trying. I think we've gotten better with the communication. We just try to keep reaching out. We're having a new meeting with the new CEO coming up with the judge and myself. So we'll try to keep working on that communication and improving it. But I was just curious what other people were able to kind of get done. But that helps. Thank you, though.
One other question I would have of you is, have you looked at the jails and possibly guardianship hearings to see somebody stepping out of a guardianship?
We can look at that again. I'd have to talk to the judge. I'm not sure his comfortability is coming from the hospital system. The way we explored the jail and we were struggling with some of the jail issues was the people who were getting dismissed and then referred to AOT in terms of under the competency restoration. Then we lost the jail doctor who was doing a lot of those, and so it was like pulling teeth to find somebody who's willing to do that if they weren't already linked somewhere. So, but yeah, the jail's aware. It's to talk with the judge to see his comfortability about outside of a hospital system.
We actually take the majority of our accepted referrals have actually come from our local jail diversion program, because they are released, but also still have are regular utilizers of crisis services or inpatient hospital services. And that has been a good source of referrals for us. We have a teaching hospital that holds the majority of the committals in our area. So that has, in and of itself, has also been a struggle for us referral wise, because our clients see a different resident every time they go to a doctor's appointment. So we don't have that consistent care with an individual to where somebody can identify them as an AOT appropriate referral.
Any ideas?
Another issue I've heard from other programs is that on the inpatient side, people get discharged before they can get a court order. Does anybody else have that? I see shaking of heads. That's a common issue. Anybody solved it yet?
No, because our court will actually just cancel the hearing then if they're discharged prior to, which can be frustrating from our perspective when we know, you know what I mean, we're going to have better treatment compliance with this person if they're on some type of order.
Yeah.
Well, the only other thing I can think of right now is if you have the opportunity under your statute to do a step up option, which typically means somebody who's in the community who needs a court order, and you can get a family member to petition, that might be another source of referrals. I know a lot of silence about that. That is more problematic. I recognize that if you have that opportunity, it's more challenging, but family members are the ones who, have so much good information about the condition of their loved one, and they know when it's time for treatment. So I don't know if you use any pamphlets or anything that you distribute in the community to let people know about that option. Well, is there anything else that you'd like to talk about before we call it a day on this chat? So quiet. So, well, what I'd like to say is thank you so much for joining us today. Remember that we're here. If you have questions of Treatment Advocacy Center, of the implementation team, we are here, and I assume we've put our contact information in the chat. Also, we hold these AOT monitor chats periodically. So if you have some great ideas about topics that you would like for us to bring up next time, please reach out and let us know. But otherwise, we are here. We would love to help you in any way we can. And I think I'm going to give you some time back. Unless anybody has anything else to say, again, thank you. And Amy, would you have anything else to contribute?
Just keep the good work going. And we would really love to see you in Annapolis.
Thanks,
Take care,
everyone.
everyone.
Thank you.